Hi, I'm Devin Ambler. I'm going to be talking about physical activity in type 2 diabetics today. My reason for choosing this particular population is threefold. First of all, the significant rise in disease morbidity rates and mortality rates in type 2 diabetes makes for a serious public health concern. Second of all, there are very large economic implications to come from this large spike in morbidity rates. And the final reason is the health complications and comorbidities and co-occurrences that we see with type 2 diabetes and the disease burden that this has on our country and on the world. So first of all, disease morbidity with type 2 diabetes, you can see by looking at this graph that between 1981 and 2011, there was a large spike in the incidence of people diagnosed with type 2 diabetes, so over 300% in fact. So this is an increase in the incidence and prevalence rates of type 2 diabetes. Some of possible determinants of this large change could be our diet, which has changed a lot in the last, around this same time period. Changes in occupational tasks, which have gone from being more active and to being more led by technology and more sedentary. And then also, as a part of this, the advances in technology that also contribute to our leisure time activities, where we spend more time in front of a screen watching a movie or working on a computer, where 40 or 50 years ago we may have spent time outside or being active around the house in our leisure time. The second part of this rationale, as I said, is the large economic implications. So an estimation from an article published by the American Diabetes Association was that the cost of diabetes in 2012 alone was $245 billion. And this is divided between direct medical costs and also reduced productivity. So this could mean lost productivity on the job or lost productivity in the home, which adds up to $69 billion. Medical costs are also much higher for people that have diabetes. 1 in 5 health dollars spent in this country are spent on those who have diabetes, and the average medical cost of a person with diabetes is $13,700, $7,900 of which is attributable to diabetes directly. I do add the caveat that, of course, if we were to eradicate type 2 diabetes altogether, this would result in higher costs as a result of just having people alive longer and more people on the planet. So that is something to consider as well. Third, there are multiple complications and comorbidities that are observed with type 2 diabetes. So the biggest physical problem that we see as a result of type 2 is the effect that it has on the heart and blood vessels. So there are large circulatory problems with most people who have type 2 diabetes, and as you might imagine, this becomes a systemic problem and then can wreak havoc on other parts of the body. We see compromised vision, we see kidney damage and renal failure, hearing impairment, even some cognitive impairment. It's been linked to Alzheimer's. And a very common symptom in type 2 diabetics is that there's nerve damage or neuropathy in the lower legs and feet. And this can result in pain and discomfort and difficulty with physical activity. And then, of course, there is obesity, which is almost 100% overlapping with those who are type 2 diabetic, and we come to associate the two almost as one disease. And obesity, where it used to be a weight classification, has now become sort of a diagnosis in and of itself and comes with its own complications and co-occurring conditions, which then get pulled under the type 2 diabetes umbrella. So looking at rates of physical activity in type 2 diabetics, what the two studies that I found resulted in were pretty much similar statistics in that males reported meeting physical activity recommendations of 150 minutes or more a week of moderate or vigorous activity. Through self-report, they were meeting it about 65% of the time. And females reported meeting that recommendation about 30% of the time. This one study that you see from this chart here also looked at physical activity based on metabolic equivalence and still saw similar numbers. So about 65% in men and somewhere around 30% in women. And a second study corroborates these numbers with about 60% of men reporting that they meet the recommendations and 38.5% reporting of women reporting that they meet the recommendations. So, and this is among diabetics. So men are certainly doing better than women, but neither sex is doing particularly well, and so this is a concern that, again, needs some attention. These are two maps that the CDC published that probably most of you have seen some of these maps that they publish. The one on the left in the orange is a county level diabetes prevalence map from 2007, and the one on the right is an age-adjusted estimate of percentage of adults who are physically inactive in their leisure time. What we largely see in these types of maps and obesity maps from the CDC is that the Southeast has a very high prevalence rate of inactivity, diabetes, obesity, so there's lots of overlap there. Obviously, we cannot imply or suggest any causation here, but the correlation between the prevalence of diabetes and the estimate of inactivity in leisure time is just an interesting connection or correlation that I wanted to point out. With regard to physical activity and disease management, I found it very interesting and wanted to point out that on the American Diabetes Association website and the Centers for Disease Control and Prevention website, exercise or physical activity even, is difficult to find as far as treatment or preventative practices. So treatment and care for the American Diabetes Association talks about blood glucose testing, medication, doctors, nurses, etc. And preventative care practices that the CDC keeps statistics on for diabetics are things like foot exam, daily self-monitoring of blood glucose, doctor visits for diabetes, etc. So this is not to say that either one of these organizations does not promote physical activity for disease management, but they are not the most salient, physical activity is not the most salient thing that you'll find on their websites, which I think is really interesting and probably speaks to the fact that some health practitioners don't even want to talk about physical activity because it can seem paternalistic or patients can be resistant to starting a physical activity program. So having said that, there are some significant barriers to physical activity that are both self-reported and also are a result of physiological and medical conditions for type 2 diabetics. So things like lack of social support, lack of time, finding exercise boring, lack of a safe environment, all came up in some studies around diabetics and barriers to physical activity. These are things that we might expect to find in any general population, reasons that we don't want to exercise or can't exercise. So there was a lot of overlap there. The first three barriers that I've put up here in bold are more disease specific. So the biggest one is probably changes in disease management. And so most type 2 diabetics are going to be put on insulin or some other medication that's going to lower their blood sugar, because type 2 diabetics typically can experience high blood sugars, which is problematic for the health. The problem is that when you start doing physical activity and exercise, that also helps to lower the blood sugar, which is a good thing. However, if you're using both medication and physical activity, this can result in dangerously low blood sugars, which can be detrimental to your health, dangerous, and just generally uncomfortable. With regard to pain, that's another significant barrier that possibly the general public experiences, but it is it's added to in those with type 2 diabetes, especially those who are carrying around excess weight, which is a large percentage of that population. This puts undue strain on their joints. They may experience arthritis, and then again, that neuropathy, the poor circulation in the lower legs and feet, can lead to burning and lots of pain, which can make exercise and physical activity difficult. And the third disease-specific barrier is a compromised VO2. So basically, people who have type 2 diabetes experience lower peak oxygen consumption, which compromises physical activity and can also threaten the health of the cells and lead to higher mortality rates and can be quite dangerous. So these are fairly formidable challenges to overcome. In terms of my suggestions for an intervention setting based on the barriers that I just discussed, importantly, an environment for physical activity has to be socially supportive. So again, this is true for the general population, but in particular for diabetics who may be testing their blood sugars or possibly injecting insulin, which can be an uncomfortable or embarrassing thing to have to do, then a socially supportive environment is really key to that success. So they may be able to work out with people who are also diabetic, people who are also heavy if they are, or who are otherwise medically limited in their physical activity. The second component is that the setting should be fun and engaging. Again, lots of people experience disengagement with their fitness and their physical activity, but in particular, type 2 diabetics may be unaccustomed